What causes GERD? So basically, gastroesophageal reflux disease (GERD) is extremely common in the society. I mean, most of us would have an episode of two of GERD per year at least. This usually happens when you actually have very rich food, very deep fried, oily food, consume excess alcohol, smoking. So when you overeat, tend to overeat or eat rich food, the stomach emptying is impaired, and the food and the acid, the gastric contents tend to come back up into the chest and cause gastroesophageal reflux. When do the patients usually come to a doctor is when they have persistent GERD symptoms. When you have persistent symptoms of reflux which are occurring over months and years, so and you're chronically suffering, so their day-to-day quality of life is impaired, and their sleep is impaired, their ability to enjoy food is impaired, and they're having extraesophageal symptoms like chronic cough, throat irritation, difficulty in swallowing. That's when they actually come to a doctor. Most of the time, GERD could be related to a lot of factors. GERD could be related to your underlying excess smoking, alcohol intake. Obesity has a major contribution to GERD, and patients who tend to overeat, binge eat a lot, patients who are onto a lot of fatty junk food. So all those foods, basically the oily, fatty foods, they tend to impair the stomach emptying gets slowed. Because of that, the intragastric pressure increases and food sort of comes back up into the esophagus. In addition, there can be mechanical problems. So on you can have actually the LES. So all of us have a sphincter where the esophagus sort of opens into the stomach. When you swallow food, it goes like a peristalsis that comes here till the G junction. That's like a toll gate, let's say. So when the vehicle comes to the toll gate opens and lets the vehicle through like that. When you swallow food, it comes till this gastroesophageal junction. The gastroesophageal junction opens and the food goes through. And once you eat food, the food tends to digest in the stomach. The food you in the inside stomach, you have the food you eat, the acid secretions of the stomach, the bile, the air you swallow. All those tend to mix for 3-4 hours, slowly empty into the intestine in those 3-4 hours, and then you're ready for your next meal. But in this period, the G junction valve, it sort of prevents things from coming back up. So in patients with if your G junction valve is disrupted, because it could be loose, lax LES we call it, or you could have a hiatus hernia in which the lower esophageal sphincter, which is normally inside the abdomen, it sort of migrates up into the chest. In these kind of situations, you can have mechanical problems which cause gastroesophageal reflux disease.